Hi everybody, my name is Andreas. I'm the Director of Audiology at Hearing Solutions, and what I'd like to talk to you about today is Diabetes Awareness Month. So November is Diabetes Awareness Month, and that's actually really important for your hearing healthcare. I want to talk about how our hearing relates to diabetes. And I think this is really important because a lot of people today still are thinking about their hearing purely from a communication point of view. And they're viewing hearing problems as, just the need to repeat and maybe some miscommunication items. But we need to change our thinking when it comes to our hearing, because our hearing is a part of our overall health and our overall well-being. We need to understand that that's a two-way street. A lot of things that we've learned in the last decade show us how our hearing can impact our health. And so when we're not hearing our best, that can impact our health in a lot of different ways. Studies have linked that to things like depression and anxiety, stress, things like that. Increased risk of dementia, for instance. And these are examples of how our hearing might impact our health. However, it goes the other way as well. Our health can often impact our hearing too. That's been well demonstrated in terms of our cardiovascular health, for instance. When our cardiovascular health suffers, then our hearing can suffer as well. And so we need to have a better understanding of how hearing is a component to our overall health and our overall well-being. The reality is, 1 in 3 Canadians either has diabetes or pre-diabetes. And so that means chances are either we're directly impacted by diabetes or somebody close to us likely is, whether we realize it or not. And so that makes it a major topic. There have been studies that really show the links between hearing and diabetes to the degree that in 2008, for instance, there was a study that showed that having diabetes doubles our risk for hearing loss. And even pre-diabetes increases our risk by 30%. And so that's quite significant. A lot of people are then asking, well, what are the mechanisms or how does diabetes impact our hearing health? The answers aren't necessarily clear, and there's a few different theories, but the common link between all of them is high blood sugars. And so high blood sugars are known to have an impact on our nerve pathways, and our nerves are really the way we're hearing. Our ears are delivery systems to our brain, and there's a number of nerve pathways that deliver those messages to the brain. And so if the nerves are being impacted, so is our hearing. And that's well seen in other areas. So diabetic neuropathy, for instance, is what that's referred to. The other pathway in which our hearing can be impacted is through blood vessels. And so the blood supply to our ears is very, very important. There are tens of thousands of nerve fibers that are supporting our hearing system, and they're very, very dependent on blood supply and rich oxygen levels. And so if that blood supply pathway is being compromised, then so is our hearing. And that's been well shown that depriving good blood supply to those nerves can damage our hearing systems. Diabetes is known to damage blood vessels through high blood sugars in a number of ways. It's one of the ways we know that diabetes can affect our vision or our kidneys. And so it's the same is true for our hearing. And I touched on it a little bit earlier, how cardiovascular health has also been linked with our hearing for the same reason, that we can improve our cardiovascular health, our ability for our heart to supply good oxygen-rich blood to our hearing nerves. That's likely to reduce the risk of damage or hair cell nerve loss in our inner ears. Doesn't really matter which one of these two pathways is the real cause. It might be both of them to some degree, but the common denominator is really high blood sugars, and so that's how we can see that diabetes is related to our hearing as well. So the question is, great, what do we do about that? I think there's a number of different ways in which we can be proactive. And first and foremost is managing our diabetes. And so if anyone has diabetes, making sure that those blood sugars are being controlled, that's the first starting place. And for many people who know they're at increased risk, but perhaps aren't diabetic themselves yet, I think that it's easy to be complacent, and that is a real risk factor. I believe that, where we need to be a lot more proactive so that we're not causing a cascade effect where we're increasing our risk in so many other areas. I mentioned the hearing aspects because that's something that's close to my heart, but we've mentioned a number of other things such as vision and kidneys and so many other things. So managing our diabetes is perhaps the most obvious, but that's the first one on the list. The second, and something that I'm a real advocate for, is managing our overall health better. And again, touching on how this is a two-way street. When we can do everything in our power to manage our health better, we're going to have benefits in so many other areas. And one of those is our hearing. And our hearing is truly something that we don't appreciate until it starts being compromised. And if we could avoid that pain later down the road, I think that would be a beautiful, beautiful outcome. So managing our overall health is another good one, whether that's through diet or through exercise or following our other treatment plans that are important for us. I think that's something that would really benefit us. And then the third one is advocating again and again for hearing checks. I can't stress it out enough that outcomes are so much more better for patients when we can do something early. And so the starting point for that is having a hearing check early on. And for anyone who's at increased risk, whether they're diabetic themselves or pre-diabetes, it's a call to action to have those hearing checks done earlier. Because when we're equipped with that information, it can tell us what to do. It can notify us that maybe some early damage is happening. And so that gives us the opportunity to course correct in terms of our health care, maybe managing our health or our diabetes better, our diet, whatever it is. It's also giving us an opportunity to do something about our hearing sooner. And so we see many, many individuals, and the data again supports it, that it's easy for people to push off their hearing health care, whether it's because they found coping mechanisms or the onset of hearing loss is quite gradual, and so they haven't noticed those day-to-day changes. The reality again is that people delay their hearing checks and delay treating their hearing loss. And if we could again do something about that by becoming aware earlier and treating hearing loss earlier, the outcomes are so much better as well. So if we take nothing else out of this, I think it's important to understand that our hearing is intimately connected to our overall well-being, our health, the way our brain functions, and the way a number of other health systems function as well. And so if we have the opportunity to do better in that regard, I think that's a wonderful thing. And one of the things that's easily within our control, that's a painless process, is having those health checks earlier, getting a hearing check sooner. If you're somebody who's diabetic themselves or at increased risk for diabetes, then that should be happening sooner, probably around the age of 50 or 55 at least, so that you have the opportunity to do something earlier. So I hope this has been helpful. Tell someone you love, tell a friend about this, because I think it's an important topic to be aware of. Thank you.